I'm Joseph Breen, an otolaryngologist and neurotologist at the Mayo Clinic in Florida. Neurotologists are ear and skull-based surgeons that treat patients with a variety of hearing and balance-related symptoms. One such symptom that we're seeing more and more frequently is pulsatile tinnitus, or hearing a pulsing sound in one or both ears. This is different from the constant ringing or buzzing tinnitus that's sometimes associated with hearing loss. Most commonly, patients with pulsatile tinnitus describe a whooshing or a thumping sound that's heard in sync with their own heartbeat, often when they're in a quiet environment. We all have a complicated system of blood vessels passing by our ears, delivering blood to our brain and other important structures of the head and neck, but it's usually not normal to hear the sound of this blood flow. There are many conditions that can cause this symptom, ranging from tumors of the ear to changes in the bony coverings over blood vessels that pass through the skull. Some of these conditions can be benign but bothersome, while others can be a threat to hearing, balance, vision, or even life. If you're experiencing pulsatile tinnitus, particularly if it's just on one side, it's important to let your doctor know about this symptom. In addition to looking at your ears, your doctor might order CT or MRI scans of your head or refer you to an ear surgeon. At the Mayo Clinic, we have a world-class team of ear surgeons, audiologists, neurosurgeons, neurologists, ophthalmologists, and radiologists that can assess and treat you for different causes of pulsatile tinnitus. In many cases, these conditions are very treatable. A condition I frequently see that can sometimes be treated with a low-risk surgery is sigmoid sinus dehiscence. This is a loss of bone over a large vein that brings blood from the brain back to the heart. We can place additional bone over or resurface these areas through a surgery performed behind the ear called a mastoidectomy. The surgery is done under anesthesia and often as an outpatient, requiring no hospital stay. Complications are rare and complete recovery is usually possible within a couple of weeks. Most patients experience significant or even complete relief from their pulsatile tinnitus after surgery with few to no long-term side effects. Sigmoid sinus dehiscence and other conditions that cause pulsatile tinnitus can be associated with other problems like elevated spinal fluid pressure, which can be dangerous if left untreated. This is why it's important to be evaluated at a place like Mayo Clinic in Florida, where we can bring together all the specialists relevant to your unique condition, evaluate you with the latest diagnostic technologies, and provide the highest quality of care. You can find more information about our group, including how to schedule an evaluation with us at mayoclinic.org.